am from Mexico. I am a psychiatry and child and adolescent psychiatry. I also have a master and PhD in medical science, and I actually work on a National University of Mexico. I'm going to present you about the effect of COVID-19 on medical education on primary care, because I think it is important about mental health and also medical education factors that can affect education of primary care workers. So as we know, at the end of December 2019, a new disease called COVID-19 caused by SARS-CoV-2 coronavirus was reported in Wuhan, China, which quickly spread both nationally and internationally, being declared a global pandemic by World Health Organization on January 3rd, 2020. In Mexico, the first case of COVID-19 was reported on February 27, and the first death on March of 2021. Given the number and evolution of cases and deaths occur on March 30, a health emergency the fourth magnitude was declared. So as we know also, COVID-19 has caused an unprecedented disruption to the medical education process and to healthcare systems worldwide. The highly contagious nature of the virus has made it difficult to continue lectures as usual, thus influencing the medical education process, which is based on patient education-based and lectures. So the COVID-19 pandemic puts people at risk of developing life-threatening conditions, presenting substantial challenge for personal healthcare personnel. So this challenge has resulted in limited patient care due to the focus of COVID-19 patients, which restricts the ability of bedside teaching opportunity for medical students. Consequently, they are unable to complete their clerkships, medical training, through clinical rotation has been suspended. Also, there are fear of being sick and other kind of things that can also affect mental health of medical students on primary care. Also, because of the highly contagious nature of the virus has made it difficult to continue a normal kind of education, and also we have to add the fear of potential transmission of COVID-19 to family members, the one that will love and the one that will live with, limit access to daycare centers, schools, and permanent feel of stress associated with have to meet basic family needs with workloads in primary medical care in Mexico. So consequently, there are risks of development so much psychological distress and other mental health symptoms. For example, it is reported that there are a lot of rates of insomnia, anxiety, depression, although being a doctor is often described as one of the most rewarding professions. It's also known to involve high levels of stress and demands, and those increased during this pandemic. So we put off the objective to study a group of first contact doctors who have clinical or healthcare activities to know the socio-demographic academic characteristic and analyzing the way in which these variables relate to presence of emotional symptoms of discomfort and some mental health problems and difficulties in e-learning during COVID-19. So we conduct a cross-sectional survey from May to December 2020. The survey involved a questionnaire that was distributed online to medical students of primary care. Participants were not aware of the objective of the results to reduce the risk of any possible bias. The questionnaire was self-administered without the intervention of the others or any specific person. I did not contain identifying data of the participants to guarantee confidentiality. The questions were, the sections of the questionnaire were informed consent documents, sociodemographic data, profile of medical training, including if they are having contact or taking care specific in COVID areas, health status, change in activities because of the contingency, concerns and needs for support. We make a descriptive analysis with frequencies and percentages, mean and standard deviation according to the variable, totality test and Pearson's for comparisons and multivariate logistic regression models radio with a P under 0.5 as significant. The result, as we can see, there was a total of 250 physicians, 52% were males with an average age of 35 years. Most of them have a partner and an average of 2 children. And also 75% were partially confinement in a health condition. More than 70% indicate that in this period they live with their family. And only 12% live with their children because they decide to be separate during the confinement, during the pandemic. So, and the majority work in COVID areas. So I can show you the sociodemographic table. We have the difference between women and men and about marital status. And also that I think it's something important, is the distribution by years of residence. The majority were from second year of medical training in Mexico. We call family medicine the primary care, the first line of attention. And it is important also that we can see that there are some personal adversity. For example, the majority have patients with severe suicidal ideation because there are a lot of increases in suicide rates in Mexico during COVID-19 because some of people that have a primary diagnosis with COVID-19 because of the prognosis at the beginning, they commit suicide. So there's something that they have to deal with in primary care. And I think that it's a factor. It's an important factor about the emotional changes that they have, because we found that the principal emotional diseases that we have on this sample was insomnia, sadness, discouragement, constant worry or tension, constant fear of getting sick, think that if someone got sick will be their fault, also hopelessness, having nightmares about being infected with COVID-19. Also, they mentioned learning disabilities. They mentioned that it was difficult to combine Zoom or Google Classroom classes with primary care because of it was a lot of demand because of the workload that they have during their duty. So it was difficult for them, and they considered they don't have really a lot of difficulties, but during their studies. And this, I also think this is important about the difference between mental health problems that they report during this pandemic, because, for example, from women, they on 43%, they report major depression, anxiety disorders, also burnout and sleeping problems, insomnia, that I was already mentioned. And it's important the difference between women and men. No, as we can see, there are more healthy mental health problems in women versus men in all mental health problems. And I think this is important because we have to take account gender difference during workload and during education. And also it is important the increase in men about substance use. For example, the increase in alcohol and also cannabis and tobacco during this pandemic. So it is important we didn't measure like the ways that they contain or with those kind of stressors that they live during residence, but it will be interesting to know the different kinds of ways that they deal with stress. No, maybe some men deal with stress, which is some kind of substance use. A medical school, as in Mexico, have suspended the educational process due the COVID-19 pandemic. However, when students inquire about their current enrollment status and whether they suspended or paused their education due to other causes, we found that the majority of students did not suspend their education and were officially enrolled. Yes, because we have we have the same kind of a number of inscription to primary care training as we have in previous years. So they have the interest to study family medicine, but even due to the difficulties of COVID-19. Most of the students agreed to help out in hospitals during pandemic and they agree to to collaborate with family former doctors in the attention of patients during the pandemic. And also they report that the pandemic affected training program schedule because they have to take classes at night or on Sundays or on Saturdays, because during the week there was impossible to make any space for regular classes because their professors have to be in COVID areas. So it was difficult for them to adapt this kind of schedule because we have some residents that told us that they have classes, for example, on Sunday at 11 p.m. No? So it was really difficult to being there, and to take attention in those classes, as well as their present difficulties in learning. And also social isolation as a measure to prevent the spread of infection and saturation of health systems, together with sudden transitions from face-to-face educational environments to home environments. Also, as we can see in the results in a threat to the psychological well-being and mental health of medical students on primary care, because they report a lack of concentration. As we see, they have depressive symptoms, anxiety symptoms. One of the most important mental health problems in Mexico during the pandemic were also domestic violence. So it is also important to take into account that it may be another factor that can increase stress and also lack of concentration. Also, it's important that it was reduced interaction with peers, and isolate and alterations, family function, and also we have problems on financial situation, and also this socioeconomic factor is another factor that maybe can explain the difference between the mental health problems that we found. And also another factor that can explain the difference between men and women, also it's that women, as we see in the sociodemographic factors, they have at least one children. So it was difficult to combine, that's that kind of a mother role with a doctor role, so and a student role, because they have, like, I think that those three roles, a family role, modern role, and also a student role, and also a healthcare, and an assistant role. So it's important to take out that they have a lot of things that can treat their mental health. It is important that we have to take account, because in Mexico we continue some classes by online learning, and online learning can also minimize the chance of a better mentoring relationship between teachers and students, because it was another factor that at the end the students comment that they missed that part of mentoring, because there was or no time, or the risk of contagious, or a lot of workload, so it was difficult to have this kind of mentoring. And also, I think it's important to take into account gender difference during this pandemic, because we have see an important increase on mental health problems, principally in women. Medical schools have the responsibility to ensure the training of trained physicians, especially in primary care. Online learning has expanded into medical education with important implications for teachers and educational institutes, such the need to modify teaching style, curriculum planning. As I already said, I suggest also gender perspective and assessment strategies. It is very likely that use of emergency technology for education, such as artificial intelligence or visual simulation and telehealth, are essential components of the change in medical education. It is important that we don't have to forget about clinical skills, ethical concepts, professionalism, and also doctor-patient relationship that it was really affected during this pandemic medical education, especially in primary care. So this is all for this presentation. Thank you so much for the invitation and for listening about this.